Good morning. Carol Aschenbrener from the Association of American Medical Colleges and also one of the members of the Interprofessional Education Collaborative. And do I have something to advance slides here? Great. So what I'd like to focus on this morning is diffusion is happening. And now what we really need are metrics to support the continuation of diffusion. And the data I'm going to show you are from medicine because that's where I have the data. But this doesn't mean that diffusion isn't happening in other professions. It absolutely is. So these are a few slides that we have, and this is data you're going to see alternating from the questionnaires that we distribute to gather data that supports the accreditation process, followed by data from our graduation questionnaire. And we have 4 years or more of data on both of these. So the orange line at the top is the number of medical schools reporting, and it's grown by about 20 over this period since 2007-8 to academic year 2014. The blue line is the number reporting required interprofessional education. So it's gone up from about 58% to about in the low 80%. So is that accurate? Well, the students say it is because these are the responses from the graduation questionnaire, the percentage that say they participated in required interprofessional education activities. These are the professions that we have from the LCME data on which professions are involved. Usually it's multiple professions, most commonly nursing and pharmacy, but also physical or occupational therapy, PAs, and surprisingly 25% of them say social work. That's more at this stage of the game than I might have expected. This is what the students say. Same professions in approximately the same distribution. We always like to have this check on what the schools are telling us. They see more interaction with social workers. In terms of the setting for required IPE, the blue line, which is classroom or seminar, has gone down a little bit, which is what we like to see. Patient care, which is green, has gone up steadily, as has the yellow simulation. The bottom, that's a mix of different things. So the students say the same thing. Again, the blue is active engagement with patients. The green is clinical simulations. Patient-centered case problems is the red, and lecture is the yellow. And the top one is team skills training. So we don't ask that on our school questionnaire. So decidedly change in learning experiences, and they're occurring across all 4 years of the curriculum, least in the 4th year because they're doing a lot of electives and traveling. And the goals are predominantly to learn about the other professions and their roles, to teach specific clinical skills, and familiarize the students and prepare them for team-based learning. 76% of the graduates on the questionnaire say that the IP experiences help them get a better understanding of other professions and their contributions to patient care. And we have an analysis and brief coming out either the end of this month or next month that looks at that data in more detail. And one of the things that fascinated me is there's a correlation between the dose, the number of professions involved, and whether they strongly agree or agree with this statement. So that's encouraging, and we'll follow that more carefully. So what do we want to know? Why do we need metrics? This is a critical period of time. As you suggested, there's a tsunami of evidence, and we're maybe building to a tsunami of diffusion, and now we really need to shepherd it through. So we need to know which assessments, including guided professional judgment, and I'll come back to that in a little bit, will give us the confidence that the learners are at least proficient in the competencies for interprofessional collaborative practice. And again, the level of performance you expect will be different by profession and by stage of training, and that's to be determined by the different professions. How resilient is team readiness when it's exposed to the real stress of work life? And especially when it moves from a fairly stable student team to an ever-changing clinical team. That's an important research question. Which learning experiences are most effective? And then we'd also like to know what are the faculty behaviors that predict whether the learners think that they're good role models and mentors. We talked yesterday a lot about the need for faculty development, and that's true, but we also need to think a little bit about what's the fertile ground and the infertile ground in faculty on which to superimpose that development. And then long term, are there learner attributes that predict strong collaborative team skills? And if we can identify some, then we have the even harder question of how should we consider those in the admissions process? Are they malleable or are they not malleable? One last word about the idea of guided professional judgment. I know some of you are very strong proponents of professional judgment. We just released what we call the core and trustable professional activities for entering residency. 13 behaviors that we know both from reports and from the literature the residents are asked to do at the beginning of their residency without direct supervision, behaviors that many of them don't feel confident about, and behaviors that some of the program directors complain to us about. One of these 13 is to collaborate as a member of an interprofessional team. And what we've done in these core EPAs is to link the EPAs to existing domains of competence, more than one each time, and to key competencies within those domains. And then we looked at milestones, published milestones related to those competencies, and from the milestones, extracted behaviors of the pre-entrustable or novice learner and the entrustable. Now this, for our work, entrustable doesn't mean for unsupervised practice. It means for practice without direct supervision. So you can see here, these are the behaviors that are thought to be, based on milestones, necessary to entrust the learner without direct supervision. And I think if you have these are pretty explicit. This is not, I know it when I see it. This is the beginning of we're all looking for the same thing. And if we all have the same list of behaviors, we can figure out a way to prepare faculty and create assessments that rely on professional judgment. So I will stop there. I'm really looking forward to the discussion today and most importantly to the work that you're going to do over the ensuing months. Thank you.